Hello, everybody, and welcome to our webinar on how cultural spaces can be good for your brain health. My name is Brian Lawlor. I'm Professor of Old Age Psychiatry and a founding director of the Global Brain Health Institute based here at Trinity College, Dublin. During World Alzheimer Month at the Global Brain Health Institute, we want to shine a light on dementia prevention and life course brain health. We want to talk about how we can protect our brains across the life course and into later life and decrease the risk of getting dementia. And if you have dementia, how to improve your well-being and quality of life. Now, brain health is not simply the absence of brain diseases. It's about achieving the best brain function that you can over your lifetime. How can you do this? First, by reducing risks to your brain, risks such as smoking, alcohol use, head injury. And second, by doing things that strengthen your brain's resistance to the wear and tear that aging and life brings. For example, physical exercise, good diet, social connection, reducing stress levels, participating in cognitively and stimulating activities. And very importantly, relevant to what we're going to talk about today, we know that art, creativity, and cultural engagement can stimulate the brain, can build its resilience and reserve, thereby improving your brain health. Museums and galleries are very special places where individuals and communities can come together for connection, well-being, and greater understanding. And now there is increasing evidence that visiting cultural spaces can reduce anxiety, lift depression, and decrease loneliness, and even potentially slow cognitive decline, thereby lowering the risk of developing dementia. So today we will explore the brain health benefits of art, culture, and creativity, and how museums and galleries can become innovative spaces to promote a community's brain health. We're very fortunate today to have with us a panel of 4 experts. They come from the world of art, museums, and galleries. All of them have a passion for all things culture, but also have a passion for all things to do with brain health. So some of the questions that we hope to explore today include: how are galleries and museums good for your brain health? Can we adapt these creative spaces to become more brain health friendly, particularly for older adults? What programs do we have for brain health and what needs to be developed? How can programming be created and implemented across the different sectors? So the format will be that each of our 4 panelists will first speak for about 7 to 8 minutes, and then we will have a general panel discussion and a Q&A from the audience. If you have questions, please put them into the Q&A and I'll try to get to them. Now, first of all, we have Brian Kennedy. He's going to be our first speaker. Brian is a leadership consultant and advisor to philanthropists and arts organizations. He is a consultant advisor to EA Michelson Philanthropy on Vitality Arts, a major funding initiative that promotes creative aging and addresses ageism in American arts organizations. Brian has extensive experience as a museum director in Ireland, Australia, and the USA. Brian is also an Atlantic Fellow for Equity in Brain Health at the Global Brain Health Institute. And today, Brian is going to speak to us about cultural spaces and older person's health and brain health, and the transformation that is happening in this context in the USA. So over to you, Brian.
Thanks, Brian. It's a great pleasure to be with everybody this morning and to talk about cultural institutions as spaces that can be good for your health. And we've always said that art is good for you. So I particularly want to concentrate on US art museums. I was a museum director, as you said, in 3 continents for 30 years, and then for the last 4.5 years working with Ellen Michelson and her philanthropy, with her foundation, my colleague advisor, Andras Zanto, and we've been able to really get into this area deeply. Next slide. As you said, I worked last year with you, Brian, and all the great faculty, and with the fantastic cohort, my great friends, who many of whom are probably online today, learning for a year about cognitive decline and cognitive disease and about healthy aging. We're in an aging world. Go ahead, Mary. And ageism is a huge preoccupation. As the World Health Organization said, it's the most socially normalized of prejudices. So how do we create a longevity economy, an economy that really helps us to realize ourselves creatively in our older years? And we have a lot of work to do. If every day of our life is of equal value, we know that we live in, many of us anyway, certainly in America, in a profoundly youth-centric culture. Next. Every economy will tackle demographic issues. In the United States by 2034, that is to say, within a decade, we will arrive at a situation where we have more people over 65 than under 18. And by 2060, a full quarter of the population will be over 65 and less than a fifth will be under 18. So we have a huge aging economy and an opportunity, lots of opportunities, some challenges too, to engage with people creatively, and cultural institutions can be a huge part of that. Next. I have to admit that it was a bit of a shock 4.5 years ago, beginning to work with Ellen, to realize just how ageist I'd been as a museum director. I focused, as everybody has, on trying to regenerate by bringing in young people. And we have a lot to do to be more age-friendly for older adults. Next. This is borne out by lots of surveys. In fact, the most recent one was only last week. This is the annual survey of US museum goers. And we can see that while older adults make up a bulk of frequent museum visitors, the bulk of visitors are actually casual museum goers who are sporadic or casual. Next. The big takeaway is this. Adults over 60 in America are the least likely segment of the population to visit museums. And so therefore, if we haven't concentrated on them, it's not anybody's issue being over 60, it's that we just haven't tried hard enough. So about a quarter of our visitation is over 60. And these are people who, generally speaking, have more time, have risk of social isolation, and want to be more engaged, want to be involved in the community, want to explore their own creativity and engage with other people. And so museums have a huge opportunity here moving forward. Next. Older people, by the way, can also vote, unlike people under 18. So it's a political issue. And in America, this is a staggering number. $2 billion a year is spent by US museums on education programs. But a report that Ellen Michelson funded on creative aging showed that actually 75%, 1.5 billion of this money is spent on the under 18 sector. So on children and youth, on school children, and a quarter on everybody over 18. Well, that's just plain inequitable. And so we learned this the hard way. We have to address and make more equal our distribution of programming. Next. So in just 4 years, building on Ellen's work over a long period of time with multiple kinds of institutions and involving multiple art forms, we developed a program for creative art programs for older adults in US art museums. And we've worked with 25 US art museums right throughout the country, large and smaller, doing programs which have now generated a huge number of workshops, as you can see here. And these workshops are 8 classes at a time, so it's a multiple. And this was only to the end of 2024. There's been hundreds more this year. But the survey that we did to the end of last year with about 1,000 people and 153 interviews has provided the beginnings of really good data. And this is qualitative significantly, but compounds with data produced by reports from the United Nations, from University College London, from many places around the world, demonstrating that creative arts programs within cultural institutions are actually good for your health. And this outcome was borne out, next slide, by the work that we did. When you see that on a scale of 0 to 5, look how high these ratings are by these 1,000 people. So providing an opportunity to try new things, new creativity, sparking ourselves cognitively, and giving us a sense of joy, like wanting to be with people, building community, building social connection, but also providing energy, spiritual energy as well as physical energy, just getting up and going to these classes and getting involved. All different types of classes offered by professional teaching artists in all different kinds of art disciplines, taking place inside museums and outside museums in community centers and so on, and building a community, but demonstrating the strength of arts programs for older adults. Next. And this is all part of, I think, what we're seeing as a wave, a movement. And we are in the middle of the United Nations Decade on Aging. It will end in 2030. So part of that is the whole World Health Organization movement around age-friendly cities. There are well over 1,500 cities around the world which are trying to tackle all of the issues within their communities. And these would include cultural institutions. So we're part of an overall agenda about people's well-being, to help them to flourish and to be healthy. And obviously people go to cultural institutions for cultural aims, but they can have very, very healthy benefits, which can benefit a diverse community, a more equitable community, and involve us working with others. So finally, let me say that, go ahead, there are many discussions taking place, but next week, Dominic Campbell is also on this call, will be with me and many others at the United Nations General Assembly and with Ellen Michelson in sessions involving healing arts at New York University, at the Federal Reserve, at the Guggenheim Museum. And we are moving into an area where we're now trying to establish cultural facilities for older adults. 6 of the museums that we've been working with are developing very ambitious topologies of spaces that would be age-friendly for older adults. So we've pioneered in museums, cafes, and stores to match our blockbuster exhibitions, so-called. And we've developed family centers. We've had lots of school programs. We've lines of school buses outside museums, but rarely any line of buses from, say, senior centers. So the pioneering of topologies for spaces for older adults will, I think, help everybody. As somebody said, and if you make a place age-friendly for older adults, you make it friendly for everybody. If you make it friendly for young people, of course, it wouldn't necessarily be friendly for everybody. So this is an architectural initiative around accessibility and human-centered design that I think will have great ramifications moving forward. And we will discuss that and many other aspects of health and aging next week and at multiple conferences moving forward. I'm delighted to see this seminar, and thank you, Brian, for inviting us all.
Thank you, Brian, and I hope that we will get an opportunity to discuss some of these inequities that you raised for older people getting access to cultural spaces in the discussion period. So our next speaker is going to be Caroline Campbell. Caroline was appointed the first female director in the history of the National Gallery of Ireland in 2022. And Caroline spent her career in 3 leading international art museums as a curator and senior leader: the Ashmolean Museum, the Courtauld Gallery, and the National Gallery of London. At the National Gallery of London, she worked as a Director of Collections and Research. Caroline is a graduate of the University of Oxford and the Courtauld Institute of Art, and an alumna of the Centre for Curatorial Leadership in New York. She has an outstanding reputation for delivering research, engagement, and digital programs ranging from Western art from the Middle Ages to the present day. And Caroline is going to talk to us about what the National Gallery in Ireland are doing regarding using its space for people living with dementia. And she will provide some illustrative stories that speak to the real benefits of cultural engagement for our citizens. So over to you, Caroline.
Thank you very much, Brian. And it's such an honor to be with you here today to talk about this very important subject and increasing changes and ways in which we are working, as Brian Kennedy has alluded to as well. So at the National Gallery of Ireland, and I'm showing you here on my intro slide, a detail of our very beautiful courtyard space at the heart of museum, which, like the museum's collection, is a connector between the past, the present, and the future. And in that sense, I don't just mean the art, I also mean the audiences and the people that we serve. So we believe very strongly in all our mission statements, like every museum, that our collection should be accessible to everyone. And in order to do that, we aim to provide a public programme that's inclusive and accessible to all our audiences. And of course, sometimes these are people who have different needs, although, as Brian Kennedy has just reminded us, something which works for older people is generally going to work for other people to do. So today, as Brian said, I'm going to talk a bit about how we do this in the context of brain health and of our dementia programming. Our core audience, one of our core audiences, is those adults over 60. I was very interested by the statistics that Brian Kennedy has just shown us. But traditionally, as he said, museums and galleries have focused less on the core needs of this group and much more substantially on those of the young. Now, that, I think, is changing. And I want to talk briefly about some ways we're doing that at the National Gallery of Ireland, our aspirations, and finally, what motivates us to do this. So could I have the next slide, please, Mary? Thank you so much. So this slide relates to work that we do with artists, and this shows a live performance by the artist Asbestos. Asbestos is a street-based Dublin artist. He made a performance called Don't Forget to Remember, which took place in our education studio at the National Gallery in January this year, from the 10th to the 12th of that month. And this performance included a showing of the artist's film of the same name, Don't Forget to Remember, which he made with director Ross Colleen. But over the course of the weekend, what Asbestos did in that studio was he erased 15 chalk portraits on blackboards. And those are the portraits that you can see on my slide. Now, each board depicted a memory of his mother, Helena, who has Alzheimer's. And the performance at the gallery was accompanied by a live sound installation created with artist and composer Cian Walker. And what happened was that a recording of Helena's voice was played and recorded over and over again until it gently faded away. All in Asbestos's artistic creation are a testament to the fragility of his mother's memories, slowly disappearing from Alzheimer's, but also to the continuity of that memory through the memorializing by others, including the artist himself, and those people who experienced and came to the performance over the course of the weekend. So that's one way in which we can think and talk about brain health. Another, and could I have the next slide, please, Mary, is through activity that actually takes place in the National Gallery of Ireland. And we have been providing free to access facilitator-led dementia inclusive sessions at the gallery and also in the community when there is demand for the last decade. And our dementia inclusive sessions are available both to groups and to individuals. We don't say that we have to work with a certain type of person or group of people. It's really what people want, and that's upon request. We work with group leaders. We also work with families to tailor the experience very particularly to the needs and to the interests of participants. So there's no set way in which a session will go because it's participant led, but typically they'd begin with a tour of maybe 3 works in the gallery or in a temporary exhibition. And that would be led by a trained facilitator from the gallery's team. We would want the experience to be very conversational, and it follows what we might call a look and respond approach. And after the visit to the collection or to an exhibition, there follows a practical studio session, and their participants are invited to create their own artworks inspired by what they've seen. And because there are some who will find verbal expression challenging or even no longer possible, I think what's important about this hands-on activity is that it provides people with another meaningful way to communicate their responses. And something which very much guides our practice at the gallery is the head, hand, heart model of learning. And we know that the hands-on experience of doing something creative after you've looked closely at and talked about a work of art allows participants to tap very, very much into their creativity. But could I have the next slide, please, Mary? Thank you. I wanted to talk now about how we have been providing resources for the last 5 years, essentially since the start of COVID, for people to do this type of work in their own spaces, whether this is at home or whether this is in a care setting or a community group. And this aspect of, as I've talked about, of the head, hand, heart model is key to the online resource that we've developed and made available for free via our website and also via via conversations or reaching out to our education team. And we're intending that this very simple online resource, and it's intentionally simple, can be used by anybody to assume the role of facilitator for a discussion and then a making session. So the resource includes advice on how you might conduct a discussion and how you might conduct an art making session in the comfort of your home. And we've prepared three selections really of how people might work with that. And you see the images on the screen here of a Monet from the gallery's collection and a much older painting from the gallery's collection by Francesco Granacci, who was a contemporary and friend of Michelangelo's. But the idea is that the images can really lead people's creativity, discussion, development in a variety of ways. And the key is really to create an activity that enables everyone to explore their personal responses in a very informal environment, to this being a pleasurable and a creative experience that everyone can enjoy in the moment, even if they may not have any memory of it subsequently, but they will enjoy the process of doing it and being part of it. And we have very good pickup for these sessions, particularly those in the gallery. And we have groups and individuals who have been availing of this service now for many years. I find it very, very, very pleasurable and good when I see groups of older adults who are using the gallery in this way. And we want to be able to develop our programming to develop brain health further. Could I have the last slide, please? And this is where the work, I think, for me and for many of us becomes very, very personal. This is an image of my father, Norman Campbell, who died in December after over a decade of suffering with dementia. And I think many of us who do this work in museums and other spaces are very much motivated by our personal experiences of living with dementia, as well, of course, as professional ones. And I think it is very important that this work becomes more visible in the spaces and places of the museum. My experience of living with various family members with dementia, including my father, is that those with dementia and Alzheimer's often feel very shut off from the world, but we really need to make them welcome. We all need, I would say, to develop our brain health. And I'd like to see museums to continue to offer dedicated programs that promote brain health, as well as being more aware of brain health generally in how we engage with visitors and audience, talking to the work that Brian Kennedy was discussing before. This will take time. It will also take resource and funding that we don't yet have. This work will involve working closely with health and social care institutes, with universities and philanthropists, but I'm very enthusiastic about being on this journey.
Thank you so much, Caroline. I mean, and I think it's beautifully pulling the thread through from Brian Kennedy's words as well, speaking about access, inclusion, and breaking down stigma. Brian talked about the stigma of aging, you talked about the stigma of dementia, and I think the personal story is really, really important. That's why we're here, to improve the quality of life of people living with dementia. So thank you very much for that. Now, our next speaker is Dominic Campbell. Dominic is a very experienced culture producer, consultant, and serial creator of arts and health interventions. He's the co-founder of Creative Aging International, and he's led the Irish Hospice Foundation Arts and Cultural Engagement Program since it began as a pandemic response. He also has been developing Creative Brain Week to equitably distribute knowledge between artists, neuroscientists, policy, and health makers. Dominic was the former artistic director of Age and Opportunities nationwide celebration of creative aging at Spialtona Festival and Ireland's flagship event, St. Patrick's Festival. And delighted to be able to say that Dominic is also a Global Brain Health Institute and Atlantic Fellow. So Dominic is going to provide some examples of creative projects that bridge the cultural spaces between what's happening in the community and what's happening in museums. So over to you, Dominic.
Brian, thank you. Hello to everybody that's joining us online, and also thank you to the speakers. They're a really rich and interesting group, and I think what they do is talk about how this area of work is evolving and how extraordinarily rich it is, specifically in Ireland, and also people that come through Ireland, like Brian Kennedy. I'm going to talk a little bit about the function of museums. I think I'm going to talk a little bit about uh, developments and evolutions, and I'm going to talk a little bit about where I think they are now, because I think that will line us up for the next stage. And I'm going to talk to you, I'm going to talk with you, ideally. And so I'm not going to use slides. It made more sense to me when I planned this to do it this way around. So, what is a museum? What does a museum? What does a cultural space do? Well, like this library that I'm in at the Irish Hospice Foundation, they hold things, they preserve, they hold value. But luckily, they also evolve. So in my teens and 20s, I'd be a regular visitor to the Carnegie Library in Manchester, founded in 1904. And above the door, it said, "For the education and enlightenment of lords and gentlemen." And I was neither a lord nor was I a gentleman. So I wasn't quite sure I was allowed in there. But that was 1900, 1904. They evolve and they develop, because what they do is they show and tell, as Caroline showed and told with the asbestos piece. It's as much about the experience as it is about the interpretation. They are places to think. They are places to meet and think. They are places for individuals and groups or types of thinking to meet. And they are almost like a university, but without a very clear curriculum. They're a place that things develop. And I think I've seen this, and I think you can hear it in the conversation of my co-presenters, that there are places that preview civic changes. They preview changes in the, if you will, the collective consciousness, in the culture. Now, when I started to think about what we would talk about, I did feel a little bit like the poacher come gamekeeper, because I feel like I've spent 20 or 30 years at this point sort of bashing on the door of cultural institutions. Because when I started doing this work, they weren't for everybody. They weren't welcoming places. They were very much red rope institutions. But I can show and I can tell that they have changed. They are very different in their attitudes, in their thinking around access, in what is included in their collection, or what is imprisoned in their collection, I guess. And so it's really interesting when you think about the museum evolution as an institution, or the cultural space evolution as an institution, alongside the evolution of the healthcare system, when you put the two things together. One of the things I would have been involved in my 20s and 30s was disability access. And that led quite naturally to thinking about the access for people living with a neurological condition, be that Alzheimer's or be that frontal temporal dementia or some broader dementia, as an issue of equity, of fairness, of disability. And if I look at the organizations that were involved with people with people receiving a diagnosis of dementia, what would happen 20 years ago when you received a diagnosis of dementia, and what was happening in the museums, and compare the two? It's really interesting. I was clearing out a pile of boxes the other day, and I came across a pamphlet that you would have been handed when you got a diagnosis, and the pamphlet was titled Pills and Wills and Bills. Pills, Wills, Bills. And that really was about what you had to look forward to, what kind of medication you had, your end of life, and how you could settle your finances, which isn't great for a diagnosis of dementia. We know that people can lead rich and fulfilled lives. We know that it's the society that has to adapt to the people with the condition. And that work, the society adapting, is work that you could see happening within the museums. The Azure project that I'm sure Sheena will talk about, which was started with the Elton Festival and the Irish Museum of Modern Art, the dementia accessible programs in the National Gallery. But there's also another strand of project, like Blow the Dust Orchestra at the National Concert Hall, which I think indicates where this might be going. So, short history of Blow the Dust Orchestra. It was founded as part of the Bealtaine Festival by collaboration with the National Concert Hall. And initially its challenge was those people that had played instruments all of their life, could they access the National Concert Hall and make an orchestra? they might not have played for 20 years, but would the idea of joining an orchestra work a little bit like the idea of joining a choir? And what would happen if this was possible? And so that project began, and we were able to fund it through Agent Opportunity for about 6 months. And then it continued on its own with support of the National Concert Hall for about another year, at which point I got a phone call from the lovely people that were then the education department of the National Concert Hall saying, we have a problem. The people from the Blow the Dust Off the Trumpet Orchestra are coming into the offices and using the photocopier. And when we say, why are you doing this? They say, well, because we are the orchestra of the National Concert Hall. And so they had taken ownership of the building in a way that maybe younger people didn't do. And so this led to all sorts of really interesting soul searching and discussion. But the outcome of it was that we had to think about whether this was a project that was made by older adults, for older adults, or with older adults. And it led to a much broader series of offerings. And that series of offerings was shaped by the people that were using the organization, the institution themselves. And you can see this as well in the conversations around the new Centre for Remembrance and Renewal that will be in the centre of Dublin, which will mark the history, I suppose, of the industrial schools and similar. And what's extraordinary about that conversation is how important the holding of people's stories by the National Museum has become. And so that leads us to the final bit. One of the potentials of museums is that they are a place where health is made. So healthcare is a place that fixes illness. When public health works, often nothing seems to happen. If public health is working perfectly, people don't get sick. People don't fall in the river. You don't need to pull them out. So this idea of salutogenesis of where healthcare is made is something I think that fits within the cultural and the museum sector. But if we are serious about digging down in that, we can say museums are now much better at inclusivity. They're much better at thinking about by, with, and for. They're beginning to think about neuroarts and the meeting place of neuroscience and arts. But there is a bigger challenge, which Brian Kennedy talked about at the beginning, which is the economic one, which is, as a society, we are ill-equipped to deal with the scale of aging that we are facing, let alone the associated increases of neurodegenerative conditions like aging. And so I think that's the final point, is there is research that comes at the moment from the US, from the work of Jill Sonker in the One Nation, One Project JET research, which says that the creative facilitators who run these type of projects, inclusive, responsive projects, who work with all sorts of people, have a huge level of trust. They are massively trusted by the people that they work with, in the 90%. Unlike medical mistrust, unlike trust in political leadership, unlike possibly trust in each other. And so is the museum about to become, or the cultural space about to become, the place where we can all gather in order to figure out what kind of future we want to collectively build? Thank you.
Thank you so much, Dominic. That's a very, very hopeful message about inclusion, community, and well-being. And I was just thinking about the pills, bills, and wills. I mean, I guess what we're here today is to add the thrills part to that as part of the cultural engagement. So our final speaker, before we move to Q&A, is Sheena Barrett. Sheena Barrett is Head of Research and Learning at IMA. Sheena led on the development of the Lab Gallery in Dublin City Council as a critical platform for emerging arts practice in Ireland. And she's also held roles at Breaking Ground Public Art Commissioning Programme, Temple Bar Gallery and Studios, the National Gallery of Ireland and the National Museum of Ireland, and has extensive curatorial experience. So today Sheena is going to talk to us about the IMA Horizons programme and the programs and partnerships that they have developed at IMA to support brain health in a museum and studio context. So over to you, Sheena.
Thanks so much, Brian. Yeah, it's great to hear from colleagues and partners today in speaking about this subject. Just when Brian Kennedy opened there talking about how we plan cities, I guess prior to joining IMA just over 2 years ago, I was working with Dublin City Council. So for really, I was in local government for almost 2 decades and had to think about where arts fit into the importance of general services within our lives, and the importance of that. And I suppose one of the things that I would talk with my team about is the fact that we're in this incredible position within a museum to be able to provide what are effectively we are not in a position where, like colleagues in healthcare who are in episodic healthcare, we're not at the crisis point of frontline service, but we have the opportunity to be at the front line in being of service. And at IMA, can I move down? So this is IMA, originally the Royal Hospital Cumain, and built at the end of the 17th century. It was built as a hospital, a British military hospital, and it's in 48 acres of beautiful gardens and meadows. And so in effect, we feel like we have a historic license to be in a position to be able to think about wellness and healthcare. And one of the beautiful things about working in a museum is that you have galleries which are effectively curated environments for people to experience artwork. But it is important when thinking about brain health that there are these kind of spaces where someone has spent a lot of time in thinking about your aesthetic experience and what the possibility of that is for the brain. Also on site, we have artist studios, including a program called Studio 10 that I'll come back to, which is specifically for older people who make art on site at the museum. And so these are some of our programs. We have very specific dementia inclusive programming that includes talking art, the Azure program, which Caroline has already mentioned, which was developed by my predecessor, Helen O'Donoghue, but also with Barbara Ann Harkin, who would have looked at programs at MoMA in New York and thought about how to integrate that into an Irish context, and developed a whole network and training program so that it's not just centred at IMA, but that it is now at galleries and museums across the country. We also like to think about IMA Outdoors, thinking about this whole 48-acre site. Our ambition at IMA really is to be the most welcoming institution, and in order to do that, we think about being radically public, a catalyst for change, a global connector, and also a centre for research and learning. So all of these 4 tenets of our way of working are how we think about how we approach art and ageing as well. So there's Barbara Ann in full flow there for the Azure program, which Caroline has already mentioned. It's very specifically tailored for people with early onset dementia or dementia and their carers, and gives an opportunity to look at an artwork together, connect together in the moment around that specific work. And it is a real, again, Caroline's already mentioned it, we get incredible feedback on how connected people feel in that moment within the gallery space, in looking at one artwork together, and thinking about it. It provides an opportunity to bring in any of your cultural references, understandings, and it can hold all of that together. We also, building out from Azure, we found that that idea of being in the moment and connected in the moment was hugely important to people, particularly coming out of the experience of COVID and people coming from that experience of isolation. We found that there was an interest in the Azure program beyond people who were experiencing dementia or for their carers. And in the moment, seeks to create programming that also, as well as looking at artwork, provides an opportunity to think about it in relationship to the senses, so that it really grounds you in the space. It might be, there are different modes with which we do it, but it may be that there is some breath work, some yoga, some experience of taste, smell, etc., before looking at an artwork and slowing down together. I've just put in a picture of last year's Creative Brain Health Fellows who came and experienced one of the workshops. We also think about how art gives an opportunity to, as well as connect us and slow down and engage in critical thinking and have agency. The program at IMA, our program is often, it is radically public and tends to being of modern contemporary art. It looks at important issues of our time, and we like to create space to be able to discuss those issues. So just to show an example here of an artist, Melanie Bonaggio, had an incredible installation, When the Body Says Yes. It had previously been shown at the Venice Biennale and was shown at IMA last year. And we have a long-standing program called Studio 10, which is an art program for older people based at the museum. And through looking at this artwork and then engaging in a life drawing class, a lot of the participants discussed issues that were really important for them around their experiences growing up, their understanding of their body, issues of consent, etc. And I think just to remember that art provides the act of making and the art of discussing is also hugely important as a space for older people to be allowed to have agency and be able to, express ideas in a safe environment. We also think about the whole site of IMA and thinking about creativity and also movement, and just to be able to think, we've talked quite a bit, everyone has mentioned how we really use the instruments that are available to us, the infrastructure that we have, and we include yoga throughout the summer months to allow people to be able to experience the site in this way. Paola, who does our yoga teaching, is one of our visitor engagement team, and she also leads a lot of the In the Moment programs. We also have slow art, which, as its name suggests, is an opportunity to slow down, but you really have this kind of mindful experience of looking. So again, it's thinking about that social experience of looking at art together, and learning together, I suppose, to value that moment of attention. And we know that attention is such a rare commodity, and it's also a muscle that we really need to work. And I suppose a slow art is something that we can experience throughout the life course as something to develop our neuroplasticity around it. We also take our role as a space for research and leading out on this work very seriously. So we like opportunities like you've convened today, Brian, this idea of being able to have public conversations so that we can bring the different disciplines together and really platform this kind of work, because I suppose we experience on a daily basis the huge impact that it has for people, and there's increasing amounts of data about the huge impact that it can have, via the work that you're doing, via the Creative Brain Health Fellows, via the Tilda report, that the impact of just even 15 minutes of creativity a day can have on our ability to age successfully. So I suppose just even thinking about the museum as a site of civic space that can bring different disciplines together and promote research. And as Dominic mentioned there, like to use the fact that people do have some trust in what we do to be able to platform this kind of work is very important. So that was just a recent conversation in July, but you can find any of the talks that we've had in the past on our website or on SoundCloud. We also collect work that relates to art and wellness, and this particular commission with Marie Brett, Yes, But Do You Care, is a film work that's currently touring nationally. And Marie Brett is an incredible socially engaged artist who does a huge amount of research in the preparation of her artworks and works very closely with people. And she made this film that looks at the politics of autonomy and dementia care and capacity legislation. And the work includes the voices of particularly carers of people with dementia and their experience. And it's in that sense, this artwork is an incredible way of opening conversations and dialogue that can really affect change in how we think about this work. We also think about, again, this is an artwork on the site that's part of our collection by an artist called Deirdre O'Mahony, and it's called A Model Plot. And Sundara Higgins, who's one of our Imra Horizons curators, has been working with Deirdre and groups of local people in thinking about art and ecology and the very act of engaging with the land as well as art, and having these conversations and how that supports our wellness. And I suppose one of the things that we would think about is the relationship between what I was saying previously around how art can support, looking at art can support our attention, our aesthetic understanding, and really how that translates back into how we experience the world and experience nature, and how that supports our brain health. So yeah, these are just some future things for us. But also I just wanted to include that idea of you know, the fact that art is a space for celebration and how that supports our brain health. And this was just a lovely moment over the summer with the Forget Me Nots choir as part of the Bealtaine celebration at Imma. And that is a thank you to my colleagues, Barbara Ann Harkin and Sundara O'Higgins, who do so much of this work. And that's our email address for anyone who would like to contact further. Now I just need to stop sharing. Thank you so much.
Thanks so much, Sheena. And I love the connection there. We're back to Dominic as well and Bealtaine. So lovely threads that everybody has pulled through. I guess we've about 10 minutes left, and we've got a lot of questions actually here, some very interesting questions. And what I'd like to do maybe is pose these questions to the panel. Maybe I'll pick particular individuals, and then maybe others can chime in. Maybe I'll first of all start with Brian Kennedy. There was a question here with regard to challenges. I mean, you talked about the challenge of ageism and stigma, and I think Caroline also talked about stigma. But could you speak to some of the challenges in trying to get museums to really take on board or understand the concept of a well-designed space for older people, and that could also be a well-designed space for older people living with dementia? I think you've got some experience with that in terms of some of museums that you've been working with or dealing with, Brian.
Yes, I think overall, I would suggest that for the last 20 years, we've really tried to look at disadvantaged groups in society and people who were not included. And that led over the last 20, 30 years to development of programs, for example, for people living with dementia and their carers as part of the older adult cohort. And when we've done that very, very successfully, we need to do a lot more of it. But I think thinking about it that way, we didn't think about, if you like, the politics of an advantage. So, for example, we've really struggled with architects and designers. There are some who are very, very engaged in this space, but generally speaking, architects are more concerned about the building than the people who actually will visit in it. And I think that the staff in the museum or cultural institution may also have concerns that are professional concerns that are totally legitimate, that don't focus on, for example, visitor needs. And that's been a challenge. I think that there's a belief on the part of many cultural institution leaders that a lot of older adults visit already. And I've just shown there in the latest survey that yes, older adults do visit, and they visit frequently. But for example, in our sector, in the art museum sector, people who go to art museums tend to be less likely to go to lots of different kinds of institutions. They go to botanical gardens and history museums, but they don't go to lots of other institutions. Whereas casual visitors go to lots of different kinds of arts institutions, and that may be a little bit blinding too as well. And the difficulties in establishing actually a particular space, that's probably the biggest thing. So because we don't know what that could be, and because we're very concerned about intergenerationality and intersectionality, and making sure that all spaces are available for lots of different kinds of activities and lots of different people, we're kind of blinded to the idea that when we had to think about what would be a children's centre be, we didn't have a problem about actually creating a space that would be the education centre at the children's centre. So we're having a problem really trying to envisage what would a space be for older adults. And that's been a big challenge. And we are getting lots of different, I think, efforts at this, and the 6 different museums that we're working with are coming up with very, very different answers: indoors, outdoors, new buildings, adapted buildings, spaces with glass walls, spaces with discrete spaces. So what are the privacy needs of older adults? What are the accessibility needs of older adults? All these kinds of things involve just one thing, which is nothing about us without us. And we really need to concentrate on community focus groups and participation by older adults to get this conversation going. And because we've left people out for such a long time, it's maybe a little more difficult to let them in. So we're making a lot of progress, and hopefully we'll continue to do so.
Okay, thanks, Brian. So a question really for Caroline, it really is around cultural spaces challenging not just ageism, but I think the stigma of dementia. I mean, and maybe others might want to jump in as well. But I mean, you spoke about, very passionately about raising awareness and catering to people living with dementia. Could cultural spaces be used to challenge the stigma of dementia?
That's a very good question, Brian. And I think it's something that it would be good for us to think about more how we could do it. Because I think it's one thing to say we want to do it, but then to actually make that happen. And one way, of course, is by something that we are beginning to do at the National Gallery, and I'm sure the other museums and people on this call are too, is training ourselves and our staff for how we talk to people, how we do that in a courteous fashion. It sounds very straightforward, but if someone comes and they're in, the advanced stages of a particular brain illness, they may not be speaking to you in a very polite way. They will be very agitated themselves, and it's really trying to make that person feel that they are welcome, not just by saying it, but by doing it, and by also, as Brian and Sheena have talked about, how we can make our spaces feel ones which are friendly to everyone in their physical makeup as well too. But yes, I do think another area which is related is by doing programming that is about older adults. For instance, we recently bought a painting at the National Gallery of Ireland by a Dutch 17th century artist called Raquel Reusch. She was one of the first women artists, but she's also one of the oldest artists. The painting that we bought was made by her in her 70s, almost at the age of 80, and we've used that as a way of talking about the creativity of aging.
Okay. Thank you. It's just, again, we've only got a few minutes left. I want to get to Dominic and to Sheena as well. There's a question here, perhaps for Sheena, with regard to how do you organize museum visits for people living with dementia? And do you take groups or smaller groups one at a time? How do you manage that in terms of your programming?
We have regular programming that is just like standard a couple of times a month. We also do what's called Armchair Azure, which is an online program for people who can attend online. We also take bookings for specific groups. They can approach us directly. I noticed there was a couple of other, there was one question in particular, and I love that Caroline has mentioned artists making work in older age, because a lot of the incredible exhibitions that have happened at IMA over the last few years have been by artists in their 80s. We have a show by Patricia Hurl that's in New York at the moment, who's also in her 80s. So it is certainly something to be celebrated, that we can get better as we age. In this, some would say you might have lost your opportunity to be a professional footballer, but there's still time to be a great painter. I noticed Debbie Britton, who's been a huge champion of this work, has a question there around how do we get curators to think more about how we make exhibitions, and really include thinking about older people or people with dementia in their exhibition making. And having been a curator for a long time, I think one of the things that I think is really helpful is when because you're not necessarily on the gallery floor, you don't know always what it's like for people to experience work, and to be able to feed back the kind of moments that you experience within learning and engagement teams, like to be able to feed that back to a curator, to an artist, how someone has experienced your work, and the kind of really transformative experiences that people can have through things like the Azure program, the In the Moment, etc. To feed those back really does motivate people to think about these audiences more clearly, because as Brian said, like, we don't always know what people want, but yet we can actually gather an awful lot of that experience, because sometimes someone else in your team does know. So it's just to create those channels, and sometimes just to be quite proactive about positive feedback, as well as the critical things that don't work, I suppose.
I guess this communication across the different galleries and museums, I think we're all going to learn from one another. There's a question. I think I'm going to put this to Dominic and perhaps, and then we'll end on this. Others may want to add to what Dominic says, but it's a question of it's about access, and I think older people with living with cognitive impairment, mild cognitive impairment, getting to museums. But also, I guess, the anxiety that can happen, getting to a museum and going to a strange environment. Any thoughts about those issues of equity and access, Dominic?
Yeah, two, and I'll do it really quick.
Yeah,
So
yeah.
the first one is access in places where there is no museums or seemingly no art, but there always is. Have a look at artsandbrain.com. The articles that Brian and I will be at next week that launch in The Lancet, I think will be transformative in this kind of space because it's bringing together an awful lot of extraordinarily interesting and good work. Many of the people who are on this call. The other thing that we've been doing with Creative Brain Week is bringing all sorts of different intelligence into one place to try and solve wicked, complex, sticky problems, which are about health, but they're about arts and they're about culture and about museums. They're also about the way that we build the cities of the future, the spaces that we live in. And none of these things are separate. And so I think what we are working towards in this conversation and many others is an evolving form of hybrid intelligence. Health isn't separate from the lives that we lead. So how do we match all of those pieces together?
Thanks, Dominic. I think I also at the museum in the home. I mean, the gallery in the home, I thought was a wonderful innovation, and I think that's part of the new hybrid world that we live in. And I think we've just started this conversation. I think we probably could have gone on for the next half hour, certainly half hour, maybe an hour. But I think what this tells me is that this is a conversation we've started. It's a thread that we're going to need to pull through. Perhaps we should have another in this series of how museums and galleries can be good for your brain health, and perhaps we'll bring you all together again in the very near future. But just on that note, I just want to thank our panel for getting together with us today and sharing their expertise. It's been a pleasure talking to you, and thank you to the audience for joining us. We had a very good attendance, and suggest that perhaps we really should do this again. So bye to all. Take care, everybody. Bye-bye.
Thank
Thank
you.
you so much.
Thank you. Bye-bye.
Bye now. Take care. Thanks.